A pulmonary embolism, or PE, is a blockage in one of the arteries of your lungs. This blockage can significantly impact your ability to breathe and can cause severe complications if not treated promptly. It's a serious condition that can be life-threatening. The severity of a PE can vary, but in the worst cases, it can lead to sudden death if not addressed quickly. Imagine your blood vessels as a highway system. Just like cars need clear roads to travel smoothly, your blood needs clear vessels to flow properly. A PE is like a traffic jam in one of the major roads leading to your lungs. This traffic jam can cause a backup of blood flow, leading to increased pressure on the heart and reduced oxygen levels in the body. The blockage is usually caused by a blood clot that travels from somewhere else in the body, most often the legs. These clots form when blood thickens and clumps together, often due to prolonged immobility or certain medical conditions. This type of clot is called a deep vein thrombosis, or DVT. DVTs are common in the deep veins of the legs and can develop after long periods of inactivity, such as during a long flight or bed rest. When a DVT breaks free, it travels through the bloodstream to the lungs, where it gets lodged in a smaller blood vessel. This journey can be quick and silent, making it difficult to detect until symptoms appear. This blockage prevents blood from flowing properly to the affected part of the lung. As a result, the lung tissue doesn't receive the oxygen it needs to function, leading to potential damage. Without enough blood flow, the lung tissue can become damaged and, in severe cases, even die. This damage can lead to long-term health issues, including reduced lung capacity and chronic respiratory problems. This is why it's so important to recognize the signs of a PE and seek medical attention immediately. Symptoms can include sudden shortness of breath, chest pain that may become worse when you breathe deeply, cough, which may produce bloody or blood-streaked sputum, rapid or irregular heartbeat, and lightheadedness or dizziness. If you experience any of these symptoms, it's crucial to get to a hospital as quickly as possible. Early diagnosis and treatment can significantly improve outcomes and reduce the risk of serious complications. Treatment for a PE often involves medications to dissolve the clot and prevent new clots from forming. In some cases, surgical procedures may be necessary to remove the clot or place a filter in the large vein to catch clots before they reach the lungs. After treatment, follow-up care is essential to monitor your recovery and prevent future clots. This may include lifestyle changes, such as increasing physical activity, wearing compression stockings, and taking prescribed medications. By understanding the risks and taking proactive steps, you can reduce your chances of developing a pulmonary embolism and maintain better overall health. Pulmonary embolisms can be categorized as either provoked or unprovoked, depending on the underlying cause. Understanding the difference is important for determining the best course of treatment and preventing future episodes. A provoked PE is triggered by a known risk factor, such as recent surgery, trauma, prolonged immobility, like a long flight or bed rest, pregnancy, or certain medical conditions like cancer. These factors increase the risk of blood clot formation. On the other hand, an unprovoked PE occurs without any identifiable risk factors. While less common, unprovoked PEs can be more challenging to diagnose and manage. They often require more extensive investigations to rule out underlying conditions that may predispose someone to clotting. Pulmonary embolisms can be tricky to diagnose because the symptoms often mimic other conditions. This makes it crucial to be vigilant and aware of the potential signs, as early detection can significantly improve outcomes. However, being aware of the common signs and symptoms can help you recognize a potential PE and seek medical attention promptly. Early intervention is key to managing this condition effectively and preventing complications. The most common symptom of a PE is sudden shortness of breath. This can be alarming and may come on quickly, often without any warning. It can make simple activities like walking or climbing stairs feel incredibly difficult. This can occur at rest or with exertion and may be accompanied by chest pain, particularly when taking a deep breath. The pain can be sharp and stabbing, making it hard to breathe deeply or cough. Other symptoms include a rapid heart rate, which can feel like your heart is racing or pounding. Coughing up blood, even a small amount, is a serious sign that should not be ignored. And feeling faint or dizzy. This can happen because the blood clot in your lung is preventing oxygen from getting to your brain and other vital organs. It's important to remember that not everyone with a PE will experience all of these symptoms. The presentation can vary widely from person to person, making it even more challenging to diagnose. Some individuals may have mild symptoms, such as slight discomfort or minor breathing difficulties, which can easily be mistaken for less serious conditions, while others may have a more severe presentation with intense chest pain and significant breathing problems that require immediate medical intervention. If you experience any sudden or unexplained shortness of breath, especially if accompanied by chest pain or other concerning symptoms, seek medical attention immediately. Time is of the essence in treating a pulmonary embolism, and prompt medical care can be life-saving. Always err on the side of caution and consult a healthcare professional if you have any doubts or concerns about your symptoms. Hemodynamic instability is a serious complication of PE, or pulmonary embolism, which is a blockage in one of the pulmonary arteries in the lungs. This condition occurs when the blockage in the lungs artery is large enough to significantly affect the heart's ability to pump blood effectively throughout the body. When this happens, it can lead to a dangerous drop in blood pressure, known as hypotension, which can severely compromise the body's ability to function properly. Signs of hemodynamic instability include a rapid heart rate, also known as tachycardia, low blood pressure, confusion, and even loss of consciousness. These symptoms indicate that the body is struggling to maintain adequate blood flow and oxygen delivery to vital organs. Patients exhibiting these symptoms require immediate medical attention to prevent further deterioration. Rapid intervention is critical to stabilize the patient's condition and prevent potentially fatal outcomes. Often, these patients need to be hospitalized in an intensive care unit, or ICU, where they can receive close monitoring and advanced treatment options. This may include mechanical ventilation to support breathing, medications to stabilize blood pressure, and anticoagulants to prevent further clot formation. Early recognition and prompt treatment of hemodynamic instability are crucial for improving outcomes in patients with PE. The medical team must work quickly to diagnose the condition and implement an effective treatment plan. Therefore, healthcare providers must maintain a high index of suspicion for this complication in patients presenting with suspected PE. This includes conducting thorough assessments and utilizing diagnostic tools such as chest scans or X-rays to confirm the presence of a pulmonary embolism. It is especially important to be vigilant in patients with significant risk factors, such as a history of deep vein thrombosis, recent surgery, or prolonged immobility, as well as those presenting with concerning symptoms like sudden shortness of breath, chest pain, or unexplained fainting. By staying alert and proactive, healthcare providers can improve the chances of a positive outcome for patients facing this life-threatening condition.